Dr. Rousso is now in the studio with us, and we're going to talk, just kind of go into depth about the skin resurfacing. Doctor, thanks for being with us.
Again, I'm glad to be here with you, Tracy.
Well, listen, when people come to you and you think, okay, skin resurfacing, that's what we need to do here, what kinds of conditions do you see that make you know that's the way you need to go with it?
Well, obviously, surgery that we do on people to help improve the appearance of the face is designed to lift sags and bulges, and there's so far that we can go with surgery, and then we get to a point where we have to use some other technologies to try and improve the quality of someone's skin. Yes. When the skin becomes very leathery and crepey, like crepe paper, and has a lot of fine wrinkles, then we have to do some other things. If you try and get rid of all that with surgery alone, then we get this windswept, over-operated look. So we start using things like lasers and chemical peels to help improve those people.
What causes the skin to become leathery and kind of overdone like that?
Well, obviously the type of skin that people have is important. People with more fair complexions have a tendency to be damaged by the sun more than other people. Sun is probably the biggest thing that causes us to have some damage to the skin. Right. Wind also can be a big factor. People that are out on boats a lot can see a lot of sun damage.
So if you're out in the weather a lot, you can get these conditions that really kind of that change your skin.
Absolutely. It really does. It actually affects the true quality of the skin, and you see some changes that some of them can actually become, at some point, even precancerous and lead to actual skin cancer if it's overexposed.
So when I hear the phrase skin resurfacing, I tend to think of like maybe one thing happening, but you guys have a bunch of different techniques that you can use, right?
Absolutely. It really has evolved to an incredible science over the last 20 years, really. We started doing things like dermabrasions and chemical peels many, many years ago to help exfoliate and take off the upper layer of damaged skin. And then back in the 90s, the laser began to be used to really precisely remove the upper layer of the skin in a very predictable way. And it's really been a very incredible evolution of the different types of lasers that we now have available.
So if I'm a patient of yours and I come in and I have the dermabrasion or some of the other techniques happen, what do I notice about my skin when we're done?
Well, depending on what we do, depending on how aggressive we do, it may be a very, very slight sort of peeling action of the skin where after 2 or 3 days the upper layer of skin will peel off and you'll have a much more fresh appearance. Or if there's a lot of severe damage to the skin to begin with, then we have to do something more aggressive, and that can take as much as 10 days to 2 weeks, and the skin can be very roughed up, almost to the point of looking like they've had a skinned knee. I mean, that much of a change to the skin.
Right. And so when the skin is changed, it's for the better, and does it feel better to the touch even?
Oh, absolutely. Initially these people may have a very rough, pebbly type of texture of the skin, especially if they have acne skin, scarring. Right. We can do some buffing of the skin or laser abrasion of the skin, which then smooths the actual texture of the skin, reduces the size of the pores in many cases for people that have very porous skin.
So a lot of us might get some good benefit out of that.
Well, it definitely can make a big difference for a lot of patients.
Best way for me to call you?
Best way is for patients that are interested in pursuing something like this is to contact our office at 930-9595 is our telephone number, or our website, which is www.drrousso.com, DRROUSSO.com.
Dr. Rousso, thanks for taking time with us.
My pleasure.
Always good to have you in.
Thank you.
We take a quick break, and we've got more of the program coming up. Stay with us.